Hi, everyone. We're just going to give it a few more seconds here, and then we'll go ahead and get started. Okay. So thank you for joining us this afternoon. This is our family and community webinar that Firetree presents monthly. Our topic today is alcohol use disorder, impacts of alcohol, treatment, and rates of alcohol use disorder. A couple housekeeping items first. We do have our Q&A box for questions. If you have any questions during the course of the presentation, just go ahead and put them in the Q&A box and we'll circle back at the end. I think we've worked out the kinks from last month, so we should be good to go. Additionally, there are some helpful links at the bottom of some of the slides in the PowerPoint. That includes the link for our YouTube channel, which has our webinar archive. So that includes our 13 other topics that we presented on, and can be really helpful if you haven't been with us for the last 13 webinars. So check that out. And if you have any suggestions for future topics, you can also pop that in the Q&A box as well, because we appreciate any feedback we can get as far as topics that you guys want to hear. Okay, let's go ahead and get started here. Okay. So first and foremost, as I said, our Q&A box didn't seem to be working last time, and we did get a couple of questions. So I wanted to make sure that we address them at the beginning of this webinar and do a little kind of a little throwback. So our September topic was presented by my colleague Kyle Miller, and he presented on overdose, Narcan, and harm reduction techniques. So before we move into alcohol use disorder, I wanted to kind of refresh. We had the refresh on the harm reduction that we spoke about. So one of the first questions was, what do you say to those who say that some of those forms of harm reduction are enabling? And when I read this question, I primarily thought of the syringe service programs. And that is probably the form of harm reduction that I was least informed about, I will have to say. So I did some digging to help inform my information here. And I came across this that hopefully will come up for you guys in a second, which is information, and this is a release from the CDC. So research has been going on for about 30 years to identify risks and benefits of syringe service programs. And the ones that were surprising for me was that they found that users of SSPs were 3 times more likely to stop injecting drugs. And they also saw a decline in the risk of HIV transmission, a 50% decline at that. So I thought that was pretty incredible. And the reason for the decrease in drug use is that they are doing more to link folks with treatment who otherwise may not have encountered treatment options, or who may not have had access to that information any other way. In addition, they do things like vaccines, testing for HIV and Hep C, referrals for treatment, medical care, mental health services, and other kind of support services. So when I think about harm reduction and oh boy, and enabling, especially for things like opioid use disorder and the lethality of substances with fentanyl and xylazine that we're seeing on the streets. Like, the clock is ticking so fast to try to reach people, to get them into treatment, to help them with recovery. And in terms of harm reduction, I think we need to give ourselves the best chance possible at helping folks to recover and allowing them the opportunity to recover. So I view it as kind of giving us additional resources and tools to use to be more successful in our rates when we're up against such lethal substances, so many lethal substances, especially in the more recent years. And the second question, let me pop back over here, was, I was under the impression that clean needle exchanges were illegal in Pennsylvania, but sounds like they were doing so in Philadelphia. Could you elaborate on that, please? So what I found was that Pennsylvania statutes still consider syringes to be drug paraphernalia if they're used, intended for use, or are designed for use in injecting controlled substances into the human body. So statewide, based on that statute, syringe service programs are illegal. In Allegheny County and in Philadelphia, some local leaders have publicly supported needle exchange programs, essentially kind of ignoring the state law out of concern for public health and prioritizing public health. So kind of outside of those areas, those kind of efforts can still expose volunteers to legal hassles, potentially jail time, if police and prosecutors decide that they're violating this current Pennsylvania statute. And I did find there's a really great resource that is Pennsylvania Harm Reduction Coalition. They're obtaining signatures from a lot of different entities, treatment providers, SCAs, those kind of folks, to really push for more availability of syringe service programs. And this was from, I think, 2019. But at that point, they had identified 20 syringe exchange programs that operate across the state, despite it being technically illegal. So I hope that kind of answered those questions. And again, I'm very sorry for missing them at the end of last webinar. Hopefully we're all squared away for this one. So to switch gears a little bit here, our objectives for today are to talk about alcohol use, binge drinking, and heavy drinking, to talk about alcohol intoxication, the levels of intoxication and alcohol overdose, prevalence of alcohol use disorder. I did find something a little interesting on alcohol use disorder and the COVID pandemic, so I threw that in there as well. Health risks, and then some treatment options. So although a lot of this is phrased as outcomes for heavy drinking, it also certainly applies to alcohol use disorder. So for the basics, this is probably a graphic that a lot of us have encountered probably before. But to start with, what is a standard drink? So for the United States, a standard drink is 0.6 ounces of pure alcohol. So that could be 12 ounces of beer, 5 ounces of wine, 1.5 ounces of liquor, and 8 ounces of malt liquor. So to differentiate from a drink and excessive drinking, so excessive drinking includes binge drinking, heavy drinking, and any drinking by pregnant women or people younger than 21. So binge drinking is the most common form of excessive drinking, and it is defined as consuming 4 or more drinks in a single occasion for women, 5 or more drinks at a single occasion for men. Whereas heavy drinking is defined as consuming 8 or more drinks per week for women and 15 or more drinks per week for men. Most people who drink excessively or drink heavily, according to these kind of definitions, are not somebody necessarily with alcohol use disorder or are alcohol dependent. So there is some differentiation there. How does alcohol cause intoxication? So ethanol, which is referred to as alcohol, ethyl alcohol, or grain alcohol, is the primary ingredient in alcoholic beverages, and it's the one that causes drunkenness. It's a clear, colorless liquid that's formed when yeast ferments with the sugar in plants. Alcohol is the most common form of ethanol, and it is a widely used and abused substance, and one of the oldest abused substances. When alcohol is swallowed, it's not digested like food. At first, and a small amount is absorbed directly by the tongue and the lining of the mouth. And then once in the stomach, alcohol is absorbed directly into the bloodstream through the lining of the stomach and small intestine. And up to 20% of alcohol gets absorbed through the stomach. Food in the stomach can inhibit absorption of alcohol in 2 different ways. First, it physically obstructs the alcohol from coming into contact with as much of the stomach lining. And food can either absorb the alcohol some or simply take up space so the alcohol doesn't enter the bloodstream as much through contact with the wall of the stomach, though, so slowing down absorption rates. And second, food in the stomach will prevent alcohol from passing as quickly into the upper portion of the small intestine, which has a really large surface area, so alcohol has more access to entering the bloodstream once it leaves the stomach. So again, if alcohol is kind of sequestered in the stomach, it's absorbed slower. And we'll kind of circle back to that in a few more slides. So once alcohol is in the bloodstream, it's carried to all the organs of the body. And in the majority of healthy people, blood circulates through the body in about 90 seconds. So alcohol is impacting the brain and all the other organs in a relatively short amount of time. The full effects of a drink are felt within a pretty big time frame here, but 15 to 45 minutes, depending on the speed of absorption. In terms of acute toxicity, alcohol impacts the central nervous system where it acts as a depressant. Alcohol acts on the GABA neurotransmitter, which results in sedation, decreased coordination, and cognitive dysfunction. With chronic alcohol use, the number of GABA receptors is increased, requiring more and more alcohol to create the same level of intoxication. So tolerance. This tolerance partly explains the alertness of chronic alcohol users at blood alcohol levels that in others would cause coma and potentially death. So 7 stages of alcohol intoxication. So again, this is valid for anybody who might be consuming alcohol, as well as those with alcohol use disorder, and keeping that tolerance in mind that we talked about before. So stage 1 is sobriety or low-level intoxication. At this stage, the individual is unlikely to appear intoxicated, though certain tests can still detect impairment. Depending on the individual, judgment and reaction time might be slightly impaired. And generally, 1 drink in an hour will generally result with a blood alcohol content in this range for males and females, unless the woman is under 100 pounds. And that's according to Loyola University, Maryland statistic. Stage 2 can be referred to as euphoria, and that corresponds with roughly 1 to 4 drinks for a woman or 2 to 5 drinks for a man, again, depending on size. In this stage, the individual might be more confident, might be more talkative and animated, might be slightly euphoric, and inhibitions tend to decline at this level of intoxication. Most people refer to this stage like colloquially as being tipsy. While many of the effects of alcohol might be pleasurable to the drinker, the negative effects of alcohol, like impaired judgment, memory, and coordination, begin to appear at this stage as well. At this stage too, a person's motor responses might be significantly more delayed than at a lower blood alcohol content. Stage 3, having a blood alcohol content between 0.09 and 0.25 kind of qualifies the third stage. I've also seen this just broken down by blood alcohol content, but I like having the little phrases associated just for clarity. They may begin to experience emotional instability at this stage, a lack of critical judgment, and a significant delay in reaction time. They might start slurring their words. They may also experience impaired perception and memory, vision issues, decreased peripheral vision, blurriness, delayed glare, recovery, loss of balance, drowsiness, nausea and vomiting. And at this point, people around them are likely notice that they're visibly drunk. In stage 4, somebody with a blood alcohol content of 0.18 to 0.30 is in this kind of stage confusion, emotional upheaval and disorientation. Coordination is markedly impaired to the extent that a person might not be able to stand up and may stagger if walking. They may be very dizzy. They may black out, where they lose their memory of events that occurred while drinking without actually passing out. Stage 5, stupor, is around a blood alcohol content of 0.25 and 0.40. So somebody at this stage is extremely intoxicated and at a great risk of alcohol poisoning or overdose and death. They've likely lost a significant amount of motor function, are not responding to stimuli, or are responding very slowly and may be unable to walk or stand, unable to voluntarily control certain body functions. They may be incontinent, they may be vomiting. Somebody who's in this stage of intoxication should receive medical help. In fact, folks that are left to sleep it off may end up suffering from slowed breathing, respiratory arrest, or they may choke on their own vomit. They may, other risks can include hypothermia, arrhythmia, and seizures. Stage 6, coma, a person who has reached 0.35 to 0.45 blood alcohol content is at significant risk of lapsing into a coma. Respiration and circulation are really depressed, motor response and reflexes are decreased, and the person's body temperature drops. Certainly at risk here for death as well. And then stage 7, at about 0.45 blood alcohol content or above, many are unable to sustain their vital life functions. The risk of respiratory arrest and death is significant. I do want to be clear here too, death is also possible at lower blood alcohol contents as well. But I think this is helpful information to use when we're talking with folks, loved ones, clients about alcohol use disorder and alcohol intoxication. A lot of times, if clients are in early stages of change, they are maybe focusing on stages where they have been euphoric, they have been, stages 2 and 3, and they may be a lot less willing to talk about the consequences of reaching those later stages. But I think important context to keep in mind and potentially pull from in conversations with loved ones or people that you might encounter. A little bit more here on alcohol overdose. So an alcohol overdose can occur when there's so much alcohol in the bloodstream that areas of the brain controlling basic life support begin to shut down. So again, we see things like mental confusion, difficulty remaining conscious, clammy skin, dulled responses, low body temperature. Alcohol overdose can lead to permanent brain damage or death. Age, sensitivity to alcohol, so tolerance, gender, speed of drinking, medications, and the amount of food eaten are all factors that contribute to the level of intoxication and therefore the potential risk of overdose. Alcohol use and taking opioids, sleep, or anti-anxiety medications can increase your risk of overdose. Examples of these medications include Ambien and Lunesta, excuse me, and benzos such as Valium or Xanax. Using alcohol with opioid pain relievers such as oxycodone and morphine or illicit opioids such as heroin, fentanyl are also a dangerous combination due to them both being depressants, and it can have kind of an additive effect that intensifies their individual effects, and it could produce an overdose with even moderate amounts of alcohol. And we did get a question that is, so our Q&A box is working, wonderful. Is it true that alcohol withdrawal is the only type of withdrawal you can die from? Especially if there are benzos involved for the reasons that we just discussed. A lot of people that are withdrawing from alcohol need medically monitored detox just to make sure they're safe because of some of these factors and because of how dangerous it is. So yeah, that is true. And that's why some folks with alcohol use disorder or that are withdrawing from alcohol can't go to kind of a residential detox. They have to detox in a hospital just for their own safety because of medical staff being available, around the clock. Oh, there we go. Okay. And back to alcohol use disorder as far as a diagnosis. So a clinical diagnosis that indicates that somebody's pattern of drinking is causing distress and problems functioning in daily life. So this can range from mild to severe depending on the symptoms. And symptoms include being unable to limit the amount of alcohol you drink, wanting to cut down on how much you drink or making unsuccessful attempts to do so, spending a lot of time drinking, getting alcohol or recovering from alcohol use, having strong cravings or urges to drink, failing to fulfill major obligations at work, school, or home due to repeated alcohol use, continuing to drink alcohol even though you know it's causing physical, social, work, or relationship problems, giving up or reducing social or work activities and hobbies to use alcohol, using alcohol in situations where it's physically unsafe, such as driving or swimming, developing a tolerance to alcohol, so you need more to feel the effect, or over a long period of time of heavy drinking, if you have actually a reduction in the amount of alcohol that it takes due to liver damage. And experiencing withdrawal symptoms, things like nausea, sweating, shaking, and needing to drink to avoid those symptoms. So for alcohol use disorder, you can certainly be a binge drinker and have alcohol use disorder. None of these requirements state that you have to drink every day to be diagnosed with this disorder. So something to keep in mind. Some alcohol abuse statistics. So this is from drugabusestatistics.org, and there's a lot of interesting statistics on there. So if you have the opportunity, I would just take a look. There's a whole bunch of things that was hard to kind of pare down to just a few. But this is 2021 data from the National Survey on Drug Use and Health, and 29.5 million people, this is ages 12 or older, either were diagnosed with or had pre-existing diagnosis of alcohol use disorder. So the breakdown is 16.6 million males and 13 million females. And in ages 12 to 17, 1.7% had met the diagnosis of alcohol use disorder. Females in that age range were 61.5 times more, or percent more likely, percent more likely to have alcohol use disorder than their male peers. And in terms of being a child of somebody with an alcohol use disorder, 12.1% of children under 17 years old, 17 years old and under, live with at least one parent that met the criteria for diagnosis with alcohol use disorder. So certainly across different age ranges, a public health concern. I just really came across this while I was gathering information, and I thought it was interesting. So again, I popped it in here. Research generally has shown over time that increases in alcohol use can occur in response to crisis or after traumatic events. So things like the 1993 bombing of the World Trade Center, after Hurricane Katrina hit New Orleans in August of 2005, and following the 9/11 attacks, there were all increased rates of drinking and alcohol sales. So maybe then it's unsurprising that the COVID-19 pandemic was correlated with increased alcohol sales and use. So another factor that researchers really paid attention to was the social isolation and need of us to maintain social distancing. So for many, stress from the pandemic and that social isolation resulted in an increase in drinking. So during the first year of the pandemic, alcohol sales jumped by nearly 3%, and that's the largest increase in more than 50 years. And there's have been multiple fairly small studies suggest that during the pandemic, about a quarter of people drank more than usual, often to cope with the stress. And sales of hard liquor accounted for most of that increase. The good news is that researchers have now found that drinking levels have returned to pre-pandemic levels by around June 2021 and on. Health risks of excessive alcohol use disorder as well. So in the short term, these often result from binge drinking episodes, but injuries resulting from motor vehicle crashes, falls, drownings, burns, increases in violence, including homicide, suicide, sexual assault, and intimate partner violence, alcohol poisoning, overdose that we discussed before, risky sexual behaviors that can include unprotected sex or sex with multiple partners, resulting in unintended pregnancy or sexually transmitted diseases, including HIV, and pregnancy complications like miscarriage and stillbirth, fetal alcohol spectrum disorders as well. And then longer term, excessive alcohol use can lead to the development of a lot of different chronic diseases, and only some we're gonna touch on, kind of the big ones. So heavy alcohol consumption can lead to the development of heart conditions. Regularly drinking too much alcohol can raise a person's blood pressure due to alcohol triggering the release of hormones that cause blood vessels to constrict. So this puts extra strain on the heart and can result in the development of cardiovascular diseases, congestive heart failure, heart attacks. Liver disease, so that's probably the one that we most commonly think of when we think of long-term alcohol use and alcohol use disorder. Liver disease is any condition that damages the liver and affects its function. So alcohol-related liver disease specifically refers to conditions that occur due to the overconsumption of alcohol. During metabolism, the liver turns alcohol into acetaldehyde, maybe, a substance that's both toxic and carcinogenic. So for alcohol-related fatty liver disease, that is related to inflammation in the liver that causes an excessive buildup of fats, reducing functioning. Alcohol-related hepatitis is when the liver swells and prevents optimal liver functioning. Liver fibrosis is the accumulation of certain types of protein in the liver. And cirrhosis is when damage to the liver results in scar tissue overtaking healthy liver cells, which really inhibits and affects liver function. Cancer is another one. Chronic alcohol consumption increases the risk of developing alcohol-associated cancers. So in particular, there has been a correlation found between drinking and the following cancers: mouth and throat, larynx, esophageal cancer, colon and rectal cancer, liver cancer, and in women, breast cancer. Brain damage and accidents. Alcohol can have a toxic effect on the central nervous system. Because it is a CNS depressant, like we talked about, it can cause difficulties with thinking, abilities, and coordination. So there can be an increase in the risk for traumatic brain injury from a fall or accident under the influence of alcohol. Regular overconsumption of alcohol over many years can lead to the development of alcohol-related brain damage, and that in turn can result in a neurodegenerative condition called Wernicke-Korsakoff syndrome. And that has symptoms like vision problems, issues with walking, confusion, severe memory loss, and difficulty with day-to-day tasks. And the last category here that we'll touch on today is nutritional deficiencies and malnourishment, which are common with excessive alcohol use. So although that can be related to poor dietary choices, inefficient metabolism of nutrients also plays a big role. So heavy alcohol use causes damage and inflammation to the stomach lining and digestive tract, which reduces the body's ability to absorb essential vitamins. Excessive alcohol use can cause internal bleeding, and that can also lead to the development of anemia. So we talk a lot about risk associated, and I wanted to focus on alcohol use because, you know, there's such a big push with treatment for opioid use disorder, and that's absolutely necessary and essential to save lives. But I think alcohol use and alcohol use disorder gets less attention when the disease process is the same. It's still impacting relationships, still impacting physical health, still very dangerous, still certainly lethal. So I wanted to kind of wrap up here with alcohol use disorder treatment and a couple components as well. So there's evidence that supports multiple therapy modalities, similarly to other kinds of substance use treatment. Cognitive behavioral therapy can help people to identify feelings and situations that contribute to heavy drinking, teach coping skills and stress management techniques to change the thoughts that cause a desire to drink. Motivational enhancement therapy aims to strengthen a person's motivation to change drinking behavior and form a plan of change, build up confidence, and develop skills to be able to stick to that plan. Some mindfulness-based interventions that can help people process thoughts, emotions, and sensations, and instead of reacting habitually to those situations. And behavior therapies like contingency management can also help people develop skills to avoid and overcome triggers that might lead to relapse. When we talk about MET, we really focus on opioid use disorder medications, but there are also some for alcohol use. So currently there are 3 approved by the FDA. to help people stop or reduce their drinking and prevent relapse. Those are naltrexone. So that is the injectable Vivitrol and the tablet Revia. Acamprosate, so Camprol, and disulfiram, which is Antabuse. These medications are non-addictive and they've shown to be effective in treating alcohol use disorder. Naltrexone and Camprol help manage alcohol cravings and reduce heavy drinking. Antabuse is not used as commonly nowadays, and it blocks the breakdown of alcohol. So people really become sick if they're drinking while taking Antabuse. And lastly, some support groups. These groups are comprised of peers that offer support to each other in recovering or maintaining recovery from alcohol or other drug dependence or problems. So these are not led by a healthcare professional, so they're not considered to be therapy or a behavioral treatment. But there are several types of mutual support group organizations for the treatment of alcohol use disorder, including 12-Step, AA, probably the one that we all know to some extent, Smart Recovery, which is secular, and not 12-Step, and religious, something like Celebrate Recovery. So these mutual support groups can really be essential in people having the support they need and talking with people who have had similar struggles to increase motivation and to help them with the skills they need to maintain their sobriety. Can lithium, I did get a question in the chat here. Can lithium be used for alcohol use disorder? I think lithium can be used as a comfort medication potentially for alcohol use disorder. But I haven't seen lithium necessarily as a long-term treatment. I will need to fact check that for next time. I'm not certain. If anybody else knows for sure and wants to pop that in the Q&A box, that would be great. But I think for comfort meds, but otherwise I'm not sure on that one. Okay, and if there's any other questions real quick, you can pop those in the Q&A box. We'll give it a second. Okay, nothing else has come through. I think we got all the Q&As this time. Otherwise, so thank you again for your time this afternoon, and I really appreciate the questions that we got. Our next webinar is scheduled for November 21st at noon, and we'll be sending out our topic shortly. Again, thanks for joining us.